ready to share treatment tips with those who care at the Caregiver call center.
I got a message.
Hey, Greg, I want to talk to my loved one's doctor about changing their medication. Do you know anyone who's done that before?
Yes. Changing medications for any reason can be really stressful. So it's really important that you take the time to discuss all of your options with your provider. Now, I know somebody who is also a caregiver, who has been through this exact thing and loves sharing her story. She is wonderful. Let me see if I can get her on the call.
Hello?
Hey, Carmen, how are you? It's Greg.
Hey, Greg, how are you?
I'm doing well. Listen, I got a call from a caregiver who needs help asking their doctor about considering other treatment options for their loved one. And I thought of you because you've been through this.
Yes, I do anything to help other caregivers.
Great, me too. So how would you go about talking to your provider about adding or changing a treatment?
Well, I would say be specific about why you want to make the change. Are there any side effects with your current ASM? Is your loved one still experiencing seizures? Do you want something different for their treatment?
Right.
Just make sure that your doctor knows that you have your reasons and you've done your research.
Yeah, right on. Okay, so be prepared and then just jump in. But is there anything else that they should know before having that conversation?
I would say that it's important to build a relationship with your doctor. That starts with finding the right doctor who understands you and your loved one's needs.
Right.
Once you build that relationship, I would say that you can go to them about pretty much anything.
Yeah, that's a good point.
Just because they're a doctor doesn't mean that you can't ask them about anything.
Right.
It's important to be patient, to give every treatment a fair chance to work. But don't wait forever to ask about a different treatment if your loved one isn't responding the way that you hope they would. Trust your gut and keep your goals in mind.
So when did you decide that you wanted to try EPIDIOLEX for your son?
My son, Corey, he was diagnosed with Lennox-Gastaut syndrome when he was 5.
Okay.
We tried multiple anti-seizure medications.
Right.
I actually followed EPIDIOLEX during the clinical trials. Once it was approved by the FDA, I connected with Corey's provider and told him that I wanted to give EPIDIOLEX a try. After we talked more about it, Corey finally started treatment.
What other advice would you want to tell other caregivers who might be watching this right now?
My advice for caregivers is to remind them that you are your loved one's advocate and that you know them best. Your provider needs your opinion to help them understand how everything is going with your loved one. Don't be afraid to tell your doctor how things are, whether it's good or bad.
Communication is so important, don't you agree?
I agree.
Yeah, so what would you tell someone who is thinking about making a switch but might be a little nervous?
I would say that being nervous is totally normal. You won't know how a treatment works until you try it. Everybody responds differently to medication, so just take it one step at a time. Find the people around you that can support you, that you can rely on, whether it's your friends, family, or medical professionals, they all can help.
Well, I gotta say, Carmen, you would be a great addition right here at the Caregiver Call Center. You might even want to take my spot as Employee of the Month.
I can totally support some healthy competition if that means helping other caregivers.
Amen to that. All right. Well, you know what? I actually don't need the competition, so you stay right where you are. I need this job. Thanks for taking the call. I really appreciate your time.
Thank you.
All right. Thanks for watching. And as always, remember, you are your loved one's biggest and best advocate. When your doctor needs to know what's going on with your loved one, they're going to turn to you.
Important safety information and indications. What is the most important information I should know about EPIDIOLEX, cannabidiol? Do not take if you are allergic to cannabidiol or any of the ingredients in EPIDIOLEX. EPIDIOLEX may cause liver problems. Your doctor may order blood tests to check your liver before and during EPIDIOLEX treatment. In some cases, EPIDIOLEX treatment may need to be stopped. Call your doctor right away if you start to have any of these signs and symptoms of liver problems during treatment with EPIDIOLEX. Loss of appetite, nausea, vomiting, fever, feeling unwell, unusual tiredness, yellowing of the skin or the whites of the eyes, jaundice, itching, unusual darkening of the urine, right upper stomach area pain or discomfort. EPIDIOLEX may cause you to feel sleepy, which may get better over time. Other medicines, for example clobazam, or alcohol may increase sleepiness. Do not drive, operate heavy machinery, or do other dangerous activities until you know how EPIDIOLEX affects you. Like other anti-seizure medicines, EPIDIOLEX may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your doctor right away if you have any signs of depression or anxiety, thoughts about suicide or self-harm, feelings of agitation or restlessness, aggression, irritability, or other unusual changes in behavior or mood, especially if they are new, worse, or worry you. Take EPIDIOLEX exactly as your doctor tells you. Do not stop taking EPIDIOLEX without first talking to your doctor. Stopping an anti-seizure medicine suddenly can cause serious problems. What else should I know when taking EPIDIOLEX? The most common side effects of EPIDIOLEX include increase in liver enzymes, sleepiness, decreased appetite, diarrhea, fever, vomiting, feeling very tired and weak, rash, sleep problems, and infections. EPIDIOLEX may affect the way other medicines work, and other medicines may affect how EPIDIOLEX works. Do not start or stop other medicines without talking to your doctor. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, herbal supplements, and cannabis-based products. What additional information applies to women? If you are pregnant or plan to become pregnant, EPIDIOLEX may harm your unborn baby, and medicines like EPIDIOLEX may be passed into breast milk. You and your doctor will decide if you should take EPIDIOLEX and about the best way to feed your baby while taking EPIDIOLEX. If you become pregnant while taking EPIDIOLEX, discuss registering with the EPIDIOLEX Pregnancy Surveillance Program, 855-272-7158, or EPIDIOLEXPregnancyStudy.com, and the North American Anti-Epileptic Drug Pregnancy Registry, 888-233-2334, or aedpregnancyregistry.org. The purpose of these registries is to collect information about the safety of anti-seizure medicines during pregnancy. What is EPIDIOLEX cannabidiol? EPIDIOLEX is a prescription medicine that is used to treat seizures associated with Lennox-Gastaut syndrome, Dravet syndrome, or tuberous sclerosis complex in patients 1 year of age and older. It is not known if EPIDIOLEX is safe and effective in children under 1 year of age. Please read the EPIDIOLEX medication guide and instructions for use for additional important information. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also contact Jazz Pharmaceuticals at 1-800-520-5568.